Today we will learn one of the easy and important bone, that is clavicle. So as you can see, clavicle, it is a part of the pectoral girdle. It links the scapula to the axial skeleton, that is sternum. So we can see here the two joints formed by the clavicle. One of the important question asked in the Viva. So what are the two joints formed by clavicle? First one is sternoclavicular joint in between sternum and clavicle. It is a saddle variety of synovial joint. Next, we have the lateral end, which is also called as acromial end. It articulates with the acromion process of the scapula to form acromioclavicular joint, which is a plain synovial joint. Acromioclavicular joint, it is a plain synovial joint. So we have discussed two joints. One, sternoclavicular, which is a saddle variety of synovial joint, and at the lateral end we have got acromion, which is plain synovial joint. So when we see from the lateral view, we can see the curvatures of clavicle. So medial 2/3, it is anteriorly convex. It is one of the side determining feature of the clavicle. So medial 2/3, it is anteriorly convex, and in the lateral 1/3, it is anteriorly concave. Lateral 1/3, it is anteriorly concave. So medial 2/3 anteriorly convex, lateral 1/3 anteriorly concave. So the same thing we will revise again. Medial 2/3 and lateral 1/3. Medial 2/3, it is anteriorly convex, lateral 1/3, it is anteriorly concave. Further, we will isolate this clavicle. So we can see the two ends of the clavicle, medial end, lateral end. It has got superior surface, inferior surface, anterior surface and posterior surface in its medial 2/3, whereas in its lateral 1/3, as it is flattened above downwards, it has got anterior border, posterior border, and superior surface, inferior surface. So let us revise once again. Clavicle, medial 2/3, it has got anterior and posterior surface as well as superior and inferior surface, whereas lateral 1/3, it has got superior and inferior surface and anterior and posterior border in its lateral 1/3. The next side determining feature, it is the shape of the sternal end. The sternal end, we can see it is quadrilateral in shape. The medial end or the sternal end, it is quadrilateral in shape. So either you remember medial end or you remember lateral end. So we will prefer medial end. The medial end is quadrilateral. As we look at the lateral end, we can see it is flattened from above as well as downwards. So it is a flat lateral end, and as it articulates with the acromion process, it is also called as acromial end. So we have got quadrilateral sternal end or medial end and flat lateral end, which is also called as acromial end. Let us revise. Medial end is also called as sternal end, whereas lateral end is also called as acromial end. Superior and inferior surface, it is determined by a prominent feature on the inferior surface, that is conoid tubercle. So there are many features on the inferior surface like groove for the subclavius muscle or subclavian groove, but it is not that much prominent in certain, that much easily seen in certain bones. So the constant feature that you will be using to determine the superior and inferior, it is a conoid tubercle. So conoid tubercle, it is present on the inferior surface. So what are the three important points and features we should remember to determine the side of clavicle? So anteriorly it is convex in its medial two-third, whereas medial end is quadrilateral end. That is how we should identify the medial end of the clavicle. And when we have to differentiate between superior and inferior surface, we should go and look for conoid tubercle rather than any other feature. Prefer conoid tubercle as it is very prominent feature on the inferior surface. The superior surface, it is smooth. So medial quadrilateral end, inferiorly conoid tubercle, and medial two-third, anterior border it is convex. Now we will see the important features on the inferior surface. So I am drawing here first rib so that we can see at the medial end there is a rough area for attachment of first rib and the clavicle. So there is a ligament which is called as a costoclavicular ligament. In the second part we can see the muscle going from first rib to the groove for subclavius. It is the subclavius muscle, and this one is a coracoid process. From the coracoid process to the clavicle there is one ligament. It is coracoclavicular ligament which has got two parts. So what are the features? The features on the inferior surface, these are costoclavicular ligament in between first rib and the clavicle at the medial end of the inferior surface. In the middle of the inferior surface, it is the groove for subclavius muscle or subclavian groove, and laterally we have got the conoid tubercle and trapezoid ridge, which provides attachment to the coracoclavicular ligament. It has got two parts. One part, it is the conoid part and the trapezoid part. So these two parts, they attach to the conoid tubercle and trapezoid ridge. Remember the name of the ligament, that is coracoclavicular ligament in between coracoid process and clavicle. So these were the features on the inferior surface. Now let us see the important attachments. Important attachments are on the anterior surface, medial two-third, there is origin of clavicular fibers of pectoralis major. So we know the color coding. The red or pink is for denoting origins and blue is to show the insertions. So here it is shown by red color, the pectoralis major, clavicular fibers of the pectoralis major, they arise from anterior two-third of the medial two-third of the anterior surface of the clavicle, whereas when we go to the lateral one-third, the anterior border, it gives origin to the anterior fibers of deltoid muscle. It gives origin to the anterior fibers of deltoid muscle. Now let us see attachments on the superior surface. So near the medial end, superior surface, it provides origin to the clavicular head of the sternocleidomastoid muscle. As the name suggests, sternocleidomastoid, it has got a sternal head and a clavicular head, and the muscle, it go for insertion over the mastoid process. So sternocleidomastoid, the clavicular head of the sternocleidomastoid, it arises from medial end from the superior surface. Okay? Superior surface. And we can see a blue color at the posterior border of lateral one-third. It is the area for insertion of trapezius muscle. So lateral one-third in its posterior border provides insertion to trapezius muscle. Now we will turn the clavicle and have a look at the posterior surface of the medial end. So at the posterior surface of the medial end, we can see a small site of origin. So few fibers of the muscle sternohyoid, they take origin from this medial end posterior surface. Then we have subclavius muscle. Subclavius muscle, so the subclavius muscle, it is inserted on the middle of the inferior surface of the clavicle in the groove for subclavius muscle, and this groove for subclavius muscle, its two borders, they provide attachment to the clavipectoral fascia. The subclavius muscle, it is enclosed within the clavipectoral fascia, and at the end we will revise a important question asked in the viva. It is 7 peculiarities of the clavicle. So as we know, the peculiarities of the clavicle, it is subcutaneous throughout. So we can palpate the bone throughout from its medial end up to the lateral end. It is only horizontal long bone. It is only horizontal long bone. So it is called as a modified long bone because of this property or this characteristic. Then it has got 2 primary and 1 secondary center. The secondary center, it is at the sternal end because the secondary center, it ossifies in cartilage, and rest of the bone, it ossifies in membrane. So this is a 4th peculiarity. The clavicle ossifies in membrane except for its sternal end. So sternal end, it shows one secondary center and two primary centers for the shaft of the clavicle or middle portion of the clavicle. Usually bone, it develops one primary center, it develops from one primary center, but in the clavicle there are two primary centers. The medullary cavity is absent, which is a characteristic feature of long bones. So again, this is one more peculiarity because of which it is called as modified long bone. So it has got no medullary cavity. It is pierced by supraclavicular nerve as it ossifies in membrane. Sometimes it is pierced by supraclavicular nerve, particularly intermediate supraclavicular nerve. And last peculiarity is it is the first bone in the body to start ossifying and last one to complete ossification. So these are the important points to revise in clavicle. Thank you very much.